Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and thank you for watching our channel. If you follow us, you know that I do cosmetic facial surgery, and I'm in Richmond, Virginia, and I only do surgery from here to here. I don't do boobs, bellies, and butts. You also know that I'm a teacher, I'm an author, and I'm a surgeon. So today we're going to talk about the surgery part, and my favorite procedure is face and neck lift, and we do about 3 a week, and we have an international practice, and if you follow my videos you know that that's really my passion. And one of the most common things that people either are afraid of or that they ask is, what am I going to look like after my facelift in the early recovery period? Is it going to hurt? Am I going to be swollen? Am I going to be bruised? And you know, this is extremely variable, and I tell patients that I can tell them with extreme accuracy about anesthesia, about anatomy, you know, about medications, and so many things that you can be exact. However, the way people heal is all across the board, right? I mean, you know, some people get a little scratch and they get a big bruise. Other people get beat up and you know, you don't really see that many outward signs. So that's extremely variable. So I thought I'd put a video together, and what I did is I just did some video and did some pictures of patients one day after face and neck lift. Now, I do a very comprehensive face and neck lift with mastectomy or deep plane. Depends on the patient, their requests, what they want, what they need. And so this is my typical facelift, and these aren't just my best patients, these are typical patients. And it gives you a little idea about the whole gamut of recovery. Basically, you know, it's not really painful. Having your wisdom teeth out, I think, is much more painful than a facelift. People are stiff, okay, that's for sure. They feel tight, and of course there's some discomfort, but largely you're numb in the immediate period after a facelift. So, you know, the initial recovery is about 2 weeks, and at a month, people can box or play hockey. They can do whatever they want, but I like them to take it easy at first. So we're going to show you these patients, and then I'll show you some of my before and after pictures and tell you a little bit about what we do. Thank you so much for your time. I'm Dr. Joe Niamtu, LoveThatFace.com. Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. This is one of my favorite things, and that's the 24-hour follow-up. This patient, I want to tell you, I really take pride in what I do, and my staff does also, and we want to get the best for our patients, and usually you got a good idea, you have a good idea how the patient's going to look after surgery, but every once in a while you get a home run that you just, the result is better than you could have thought, and this is one of those situations, and this is a great patient. She's so motivated. She's in a little trouble with me, I'm not going to lie to you, because we did her surgery yesterday. Last night, she walked from her hotel to Applebee's and ate dinner, and not supposed to do that, okay?
Well, we ordered it to go. That helped.
Okay, but you're supposed to be lying in bed.
And I cut the meat off the bone. I didn't bite into the bone.
Okay, so you have to stand in the corner.
Yeah.
So basically, how was your night?
It was great. I'm in shock that I'm really not in a lot of pain. I'm just in discomfort. You know, turning my neck and stuff, so kind of funky, but
well, you did
I'm
really,
in disbelief.
You did really well. You did, again, and it's such an honor to be able to change somebody's life like this. And I wish I could get hair, but she got a profile much better than we had hoped for. So I'll let you take a look at it in a second. So the surgeries that we did upper blepharoplasty and lower lid laser resurfacing, so that's what you're looking at there. And we did a comprehensive face and neck lift with a lot of submentoplasty, a lot of liposuction and sculpting and removal of deep fat and platysmoplasty here. And we added a chin implant, which really made the difference. And let's turn sideways here a second. So I'm going to show you her before picture that you can see on the screen, and this is just at 24 hours. You can see her suture line, and it's just going to, let's go to the other side, it's just going to be great. I'll tell you, nothing makes me happier. Can you take a little step forward there, right there? Okay, that's good. Nothing makes me happier than to be able to perform such a life-changing procedure to make somebody look and feel so good about themselves, especially when it's something that has bothered them all their life. And again, it's a great honor. And we're doing this little series of talking to patients right after their facelift surgery. So this is a patient that we did facelift, lower lid laser. What else?
Mole removal.
Mole removal. There we go. Those three things. And we did this 48 hours ago. So she is 2 days out of surgery. About 50% of my facelifts are out of town. So she's going back to her hometown tomorrow. And, you know, people stay here a variable amount of time. I want to make sure that they're healed and they're not having any problems. So the more procedures you do, you know, you have to stay a little bit longer. But she's done absolutely great. So let's talk a little bit about this. How do you feel 2 days out?
I feel really good. I feel good.
All right. What's are you in much pain?
No, just a little. I'd say 1 on a scale of 10, but it's manageable.
Okay. And so yesterday was the day after surgery. How was that?
Tired. I slept a lot, but I still felt pretty good. Pain was a little bit higher, maybe 3 out of 10, but not bad.
Okay. Very good. You're a little stiff, correct?
Yes, very
All right.
stiff.
So it's really common that patients will say, "Hey, Dr. Joe, I'm scared. You know, I want to know." It's like, how do you feel the day after your facelift, 2 days after your facelift? What would you say to those people? And listen, I don't want you to sugarcoat it, okay? Because I really try and tell it like it is. And I always make the point that, you know, most people do really, really well. Every once in a while, somebody is more uncomfortable. But, you know, you've been a pretty average patient. So what would your advice be? Or?
Pain is different for everybody. Redheads feel it even more, so don't feel embarrassed if you're a redhead and you have pain. But I was fine, and I would say don't worry so much about the pain, because you give pretty good drugs afterwards, and they do take care of the pain. So
Right. Well, I appreciate it. And am I a redhead?
I have to check.
You know, I tell you, I love what I do, and the reason that I love what I do is that I just meet such great people from all over the place, and I really enjoy making them look and feel better. So thank you so much. It's been my honor to be your surgeon. You have a safe trip home.
Thank you.
Okay. So here's a patient before surgery and 24 hours after surgery. We did use a drain on this patient. We use them only occasionally. Here is a car picture. It's kind of interesting. The patient took this picture in the passenger seat on her way for her facelift and took the same picture on her way home from her facelift. So that's a car picture. Here's a patient before and 24 hours after their facelift. You can see this patient had minimal bruising and swelling, and the result is evident. A male patient before and 24 hours after his surgery. So this kind of gives you an idea what people look like. And again, this patient has some bruising, but a very evident result. Another car picture. This patient took her picture in her driver's seat before her facelift, and I believe this was about 3 weeks after. So another car picture. Thank you so much for your time. I'm Dr. Joe Niamtu, and my website is lovethatface.com. We're located in Richmond, Virginia, and again, my passion is face and neck lift surgery, and our goal is safe surgery with natural results. If you're interested, I would love to talk to you about being a patient at our office. Thank you so much for your time, and have a great day.